The Huntsman Home Rural program helps people take less trips to Salt Lake and get more of the care that they need in home. When someone's in active treatment for cancer and they have, treatments that are several times a week, gas is expensive, it's 2.5 to 5 hours. It's a big burden in many ways on people. So as a case manager for Huntsman Home, my job is just to look for ways to help people reduce their trips, reduce their burdens, and just find things to help take care of them that don't exist in their normal healthcare system. So whether that's finding ways to have a nurse come into their home and do blood work, do IVs in the home, or just get food from the food bank so they can have a meal that's more tailored to what their diet is. My job is just to meet their needs in whatever way I can. When they have telehealth appointments, we'll go to their home and help them do that. So whether they're having technology issues, I can help them troubleshoot that, and then also give the doctor some assessment information so that appointment really is almost as good as if they were there. One of the biggest barriers we have in the rural area is transportation, and we're finding that that is something that really limits people. Sometimes in the wintertime, people say, I'm not going to get treatment for the winter because they don't want to drive Highway 6, which is a really scary road. We're able to find programs that already existed, like Angel Flight, that will fly them from a rural airport up to Salt Lake for free and back. Then we also have gas cards that we're able to give people. When gas is really expensive and the trips get expensive, they have to stay overnight. There's a lot of burden that goes into just having a treatment, and so we're trying to really take down some of those barriers with some of the benefits that we have.
Chemo days aren't easy on those patients. It wears them out, they're tired, they're sick, and it wasn't always easy on Aaron.
Chemo and radiation together was taking a toll on me. It was hard. My blood levels were super down, and I didn't even get out of bed most days. I was just so sick, and we were stuck in a hotel up there living. I couldn't be around my sisters or my dad, and I just missed my family. I think that's another great thing with having treatment close to home is you can be surrounded by those you love while doing it.
Our worry in rural Utah is, are we going to get good treatment? I mean, that's why going up to Salt Lake and Huntsman's, that's not a question. That's what we're going to do. We're going to go to Huntsman's because it's the best. If we can get that in a rural place in a Price, Utah, that would just be a game changer for us.
So Huntsman Home, the rural expansion, was funded by donors, but we want to show that the value of this is something that everyone in oncology can have and would do quite a bit better and have less hospitalizations and have less delay in treatment, which leads to better outcomes. The work that we're doing in the Huntsman Home Rural program is absolutely changing lives, and I love being part of it and seeing it every day. It really is neighbors helping neighbors, and I think that's what makes rural the best place to be.